This is Devin Jones with Tennessee Farmers Co-op's Animal Health Department, and today we'll be discussing some common diseases found in cattle. Today we'll start with infectious bovine rhinotracheitis, or IBR. It's a virus also known as red nose. Pneumonia and reproductive problems are the most common results of IBR infection. Signs of IBR are high temperature, excessive nasal discharge, coughing, increased respiration, depression, loss of appetite, and the muzzle may be reddened or encrusted. In many cases, IBR affects the eyes as well, so is often mistaken for pink eye. IBR prevention can be achieved with the use of a 5-way vaccine, which usually includes BVD types 1 and 2, PI3, and BRSV. Treatment is aimed at preventing a secondary bacterial infection through the use of antibiotics. Second is bovine viral diarrhea, or BVD. It's a viral disease of cattle that can cause many problems in a herd. Although the name would make you think diarrhea is the major problem, in most herds, infertility is the most common and costly because it can go undiagnosed. Other problems caused by BVD include pneumonia, abortions, stillbirths, weak or deformed calves, and immunosuppression. Persistently infected calves, or PIs, are calves that are infected with BVD as a fetus during the first half of gestation. PI calves don't always show signs of BVD, but they shed very high levels of virus in all bodily secretions and exposes cows and calves. So more PI calves are created. Now the virus stays in the herd from year to year. Control is based on proper immunization with diagnosis and elimination of PI cattle. Testing of new additions to the herd is recommended. Treatment is of little value but may decrease secondary bacterial infections. Is bovine respiratory syncytial virus, or BRSV. Symptoms include high temperature, nasal discharge, depression, coughing, and decreased feed consumption. Like other viruses that attack the respiratory tract, BRSV makes animals susceptible to secondary lung infections. Secondary bacterial infections such as pneumonia or Pasteurella often follow this virus infection. Next is parainfluenza 3 virus, or PI3. It's common in cattle and is found worldwide. Affected animals exhibit watery to yellow-colored discharges from the eyes and nose, labored breathing, and fever. Death from PI3 infections alone is rare. However, it works in combination with other respiratory viruses and bacterial infections. The combinations are more dangerous because PI3 can enhance the damage of other disease organisms. PI3 vaccines are almost always combined with IBR, BVD, and BRSV. Prevention is based on good husbandry techniques such as minimizing overcrowding of calves, providing adequate ventilation if animals are housed in an enclosure, and vaccinating animals properly. Next is Pasteurella homiletica and Pasteurella multocida. They can act alone, in combination, or even with Haemophilus somnus to create the same disease. Pasteurella bacterial infections are many times the killer that follows the respiratory virus that has weakened the animal immune system. It is common when cattle are stressed from handling, crowding, weaning, harsh weather, or being off feed. Clinical signs include high fever, cough, nasal discharge, which is sometimes thick, rapid respiratory rates, depression, and death, which may occur rapidly. Treatment generally revolves around antibiotics and anti-inflammatories. Prevention is aimed at reducing stressors such as weaning, performing surgical procedures, and processing calves prior to shipping, gradual change of feedstuffs, decreased transportation times or allowing rest periods, limiting the mixing of cattle from different sources, and inadequate ventilation. Next is blackleg, a clostridial disease caused by a spore that lives in the soil and can survive in harsh conditions for long periods of time. Animals can ingest the spore through feedstuffs, water, or gain entry into the animal through a cut or wound. The disease is not transmitted from animal to animal. Blackleg is normally seen in young cattle from 6 to 24 months, but can occur at any age. There is a sudden onset of lameness, but often calves are found dead without a history of illness. There is swelling of large muscles and a characteristic crackling due to gas in the tissues. Fortunately, blackleg vaccines are relatively inexpensive and very effective. Last is pink eye. It's one of the most common diseases found in beef cattle. Pink eye is highly contagious and is of major economic importance due to the dollars lost to decrease weight gain and treatment cost. Pink eye is primarily caused by the bacterium Moraxilla bovis. Eye irritation is necessary for the development of the disease. Sources of irritation would include flies, tall weeds and grasses rubbing the eyes as cattle graze, and dust from feed when cattle eat. Blown dust on windy days and excessive UV sunlight also increase chances of infection. The disease is spread easily through direct contact from animal to animal and through face flies. It is believed the Moraxilla bovis bacterium can live on face flies for up to 4 days, so a single fly can infect many animals. Symptoms of the disease include excessive tearing, blinking, increased sensitivity to light, and decreased feed intake. A small white spot may develop in the center of the eye. Management practices that reduce the risk of pink eye tend to be the most effective in decreasing the occurrence of the disease. These would include fly control through the use of fly tags, pour-ons, back rubbers, dust bags, and oral larvicides. A shady area for reduced UV exposure and proper pasture management are other options to consider. Numerous pink eye vaccines are available either as the sole vaccine or in conjunction with blackleg and should be administered in the spring just prior to the fly season. Thank you for taking the time to view this presentation. Please feel free to call Lincoln Mosley or Devin Jones, the Tennessee Farmers Co-op Animal Health Department, or your local Tennessee Farmers Field staff. Thanks again.